The Centre for Rural and Remote Mental Health is based in Orange. It's designed for the people of rural and remote New South Wales. The centre started because back in 2000, people from Western New South Wales in particular went to government and they said, city-based services are not meeting our needs. What we'd like you to do is to create a special centre for us in rural New South Wales that will be 100% focused on our needs.
The centre is unique for two reasons. One, it's in a country location. People feel some affinity with the group rather than an abstract group that's in Sydney or Melbourne or Brisbane. And the second part is that the group that have been assembled here are committed to actually helping the people in rural communities.
The Centre for Rural and Remote Mental Health intends to help people to be more mentally healthy, to have a better sense of life is fun, a better sense of energy in their lives. We intend to try and improve the quality of services, and we are trying to help communities that are suffering from rural suicide to address that problem. One of the principles of the centre is that all our programs are available to Aboriginal people and to people from other cultural and linguistic backgrounds. We employ Aboriginal staff and we have an Aboriginal advisory committee. We're a full part of the University of Newcastle. We're part of the School of Health and Medicine. Therefore, we're able to call upon a whole host of experts. Everything we do is based on research, so we look for the best evidence before we design and develop a program, and we then test it to see if it works, to see if it makes a difference.
Without research, we don't have the proper evidence to say what we do works. We don't have the evidence to inform policy. So that's why it's so cool. We can really influence what goes on in health. It underpins everything we do.
We have strong expertise in policy development, workforce solutions, as well as service delivery in rural communities. We partner with a number of different organisations that really share our common objectives. They allow us to develop the capacity and reach that we need in rural communities.
One of the major programs that's developed is the Rural Adversity Mental Health Program, or RAMP as we refer to it.
One of its purposes is to link people to services. In the physical world, we've had first aid training for 100 years. A lot of people are a lot less clear about what to do if someone has a mental health problem. And so the RAMP workers do a lot of training so that people can actually identify when something's going wrong and help somebody to find appropriate professional help.
You can go out and talk to people, you can go out and talk to farmers about mental health. They know who we are, they know what we do, and they know where to go if they or one of their family have a problem.